In the previous video, we introduced one type of what economists call market failures, actually two types, which are unemployment and inflation. And we use the aggregate demand, aggregate supply model to potentially justify government intervention. In case you have unemployment, people don't have jobs, GDP is too low, government intervenes to increase aggregate demand, correct the problem. If prices are high, the government alternatively could intervene, decrease aggregate demand. Right, in this module, we will continue to justify economically the existence of a government. So within the framework of supply and demand, there are a couple more roles of government rather than just mediating the trade-off between inflation and unemployment, keeping people in jobs and keeping prices reasonably stable. We have certain goods and services, which we call positive externalities. And these positive externalities are goods and services which have benefits to people who don't consume. So for example, education might be a positive externality because even those who don't go to school may benefit from living in a more educated place. Um, Other goods are non-excludable, meaning once they're built, everyone can use them. And so it's often the role of the government to provide these what we call public goods. Right, so public good might include something like parks, roads, other services like the fire department, and so on. All right, so let's start out by talking about positive externalities. And once again, a positive externality is when you have a good or service and there are benefits of the good or service which do not accrue to those consuming. So the example that the reading has that I've posted is a research and development example. They're going to talk about research and development of vaccines or cures as being good socially because the world benefits from improved public health, right? So there are certain benefits to having a vaccine, and it is probably timely given COVID within the last year, right? So more money spent on research and development of the vaccine produces an effective vaccine. That vaccine has some sort of value, but then there's also an additional value, which is the improved public health, which comes from having some people take the vaccine. Right, so even people who don't take the vaccine may be benefiting from the vaccine or research or some cure for a disease. You could think of it as, say, polio research, right? I guess at this point, we all take the polio vaccine when we're kids, but even those who are not currently participating or benefiting from research and development on polio research have benefited from polio research having formerly been done. Right, so right, those taking the cure generally might consider their own interests, but don't always consider the social benefit. Again, especially timely perhaps in COVID because people taking or not taking the vaccine might consider their own interests, but not necessarily the social benefit. Additional social costs or benefits that don't accrue to the individual making a decision are what we call externalities. All right, so going back to this research and development example, what a positive externality is, it just means that the social demand is higher than the private demand, or more economically speaking, at any price. In this case, the price is sort of like an interest rate, but you can think of this as a price. At any price, there should be a higher quantity. So here, if we only consider private interests and not social interests, the quantity would be E0. But considering the social interests in having cures developed to diseases, the socially optimal quantity is right here. All right, and in a principles class, you would talk a little bit more about measurement and numbers. So, how much exactly is this difference and so on. Here, all we're concerned about is the definition. What is a positive externality? A positive externality is when you have benefits that don't accrue only to the individual participating in the market. So in that case, the social quantity or the socially optimal quantity is higher than the privately optimal quantity. Right, so again, we're assuming people who consume only consume for their own utility or only their own benefits, but there's benefits to everyone when the virus is not transmitted, right? So people considering, in this example, whether to invest in the virus, or maybe this is a government decision, or whether to invest in the treatment to a certain virus, right? They're considering certain maybe payoffs to selling that vaccine or selling that cure, but the social payoffs to having that virus cured, having that vaccine available, are actually much higher. So this is a positive externality. Again, don't worry too much about the numbers here. I think it's a little bit easier sometimes if you have price rather than rate of return or interest rate here on the y-axis, but that isn't important for us because I'm not going to ask numbers questions. All we need to know, positive externality means that there should be a higher quantity than the private market will provide. Right. So, you might consider another example of a positive externality, which is education. Those who go to school consider the benefits only to themselves, but a more educated population results in perhaps more invention, more entrepreneurship. There might be other social benefits to a more educated population or society. So in this case, the social demand or the socially optimal quantity of education is going to be higher than the privately optimal demand for education. So same sort of graph here. The socially optimal quantity would be higher in a positive externality case than the market provides. People consider perhaps the benefits to themselves of going to school, but they don't consider the benefits to society at large. And so it might be the government's role to encourage markets to provide the socially optimal rather than the privately optimal quantity. Again, the theory here is that without any government intervention, people would only consider their own private interests. We end up at a certain quantity. But if we were considering the social interests, the benefits to everybody at large of creating, or in this case, a virus, a vaccine to a virus, then we should have a higher quantity. Right. So in the case of positive externality, we would like a higher quantity than the private market provides, so it could potentially be the government's role to encourage markets to provide the socially optimal quantity. And again, if you went on into principles or later, you might talk about, what types of government interventions in terms of like subsidizing or negative taxes, other types of programs. We won't spend too much time there. Again, just sort of the general theory. Quantity is too low when you have a positive externality. We'd like more education, more cures for vaccines than the private market would provide. So it might be the government's role to encourage a higher quantity. Right. Alternatively, you could have a negative externality. So there, that's a supply side externality. Worth noting, although I won't test on it, that our positive externality was on the demand side, whereas we consider a negative externality on the supply side. So a negative externality is when you have a product that produces costs that don't accrue to the producers. So for example, if local industry pollutes the local water supply and then the locals have to drink out of it, then the private costs here are lower than the social costs. This stands for social marginal cost and private marginal cost, or social supply and private supply. All right, so the industries considering only the private costs of production are going to produce where private marginal costs or their private supply crosses demand, and the quantity is going to be too high. Socially, social marginal cost is much higher. People have to drink that polluted water. Big problem still ongoing in Michigan. Of course, many people heard about Flint years back, but in Michigan City, Gary, Indiana areas, they're still having big problems with water pollution to this day. So, one example of where industry potentially polluting local water supply that results in higher social costs than private costs, and so we get too high a quantity. All right, the quantity produced by the free market is higher than socially optimal because producers only consider the private costs and not the social costs of pollution. So in this case of a negative externality might be the government's role to encourage a lower quantity by implementing, here we have a tax. Again, won't test you on the particulars or the numbers, anything like that. I only want you to understand the ideas of externalities, positive and negative. A positive externality means the market will produce too little. The government encourages producers to produce more education, more vaccines. A negative externality means that the private market is producing too much. So the government discourages production, so we get a lower quantity. All right, we already talked a little bit about public goods. What are public goods? Public goods are defined by two features. One, non-excludability, meaning that once built, anyone can have access to the good or service. So you might consider just like a public park here in town. Non-rivalrous, one person using does not prohibit another from using. So again, our roads, parks, things like that, to a certain extent, are non-excludable, non-rivalrous. Of course, we know, if you spent much time up at Horsetooth on weekends when it gets hot, and maybe these are limits, and so you have to put in some sort of prices or costs. All right, public goods at heart are just free services that once built, anyone can use. So maybe your local neighborhood park. All right, oops. Go. So again, talking about Horsetooth, they have limited capacity and some pricing. So maybe that's not such a good example of a public good, but your local corner park where you don't have to pay to get in, and there's not really set limits on how many people can be there. That would be a good example of a public good, the roads we drive on and so on. All right, so it's generally accepted that without government intervention, private markets will underprovide or not provide these goods at all. You think about public parks. Who's going to build public parks if not the government? So are we going to rely on companies to come in and do that? Well, it might not be that profitable, so it might not happen. All right, so in this case, underprovided. And we accept generally that there might be some social benefits to having these public parks, other public services. So if the social benefit is high enough, should the government provide these public goods? And which public goods should they provide? This tends to depend kind of place to place, generally determined at the local community level. Fort Collins, we know, invests a lot of money and time into public parks and green spaces. Other places don't. So what explains those differences? All right, moving on into more potential roles of government, we have poverty. So we've introduced previously a few other roles of government, correcting inflation and unemployment. We have externalities, positive externalities. What about poverty? So, what extent is it the role of government to correct poverty? So this is a question that economists study to a large extent. First of all, the measurement of poverty itself, what defines poverty, and then again, ultimately debates about what is the role and the extent of government intervention that's warranted to correct poverty. So governments might engage in some sorts of welfare activities designed to combat poverty. We measure poverty as the population or the proportion of people below a certain income threshold. And then, even you hear discussion or debate about what should this income threshold be to be in poverty. Right? If you set some sort of national standards, you're going to have some places with low costs of living and some places with very high cost of living. And so this measure of poverty sort of has to depend place to place. Right? Someone making $30,000 in the middle of Nebraska lives a very different life than someone making $30,000 in the middle of New York City. Right, so poverty measures have to incorporate cost of living and define sort of a quality of life threshold, measuring the number of people who fall below that threshold. Government, again, might institute some policies to combat poverty, but these policies could work. They could also have unintended consequences that are negative. So one unintended negative consequence of government intervention in poverty is called a poverty trap. This refers to a situation in which the government assistance is cut as individuals earn a higher income. And so there's a graphical treatment in chapter 15 posted of the poverty trap, which it won't be tested on. Those who are graduating with econ degrees or have econ backgrounds might take a look at that as kind of an interesting graph, an interesting concept of this poverty trap. But again, we're just going to talk about poverty trap definitionally. And so a poverty trap is just when government assistance gets cut as individuals earn higher income. So real spending power or real purchasing power doesn't change. And then the worker has the decision of how many hours to work. Right? If the government assistance is going to be cut as work hours rise, then the utility maximizing choice might very well be not to work. So in contrast to the stereotype of the lazy poor or people who are in poverty or poor because of their own decisions and their own choices, there's a lot of ways that people can find themselves in poverty, not of their own choices. Being a veteran in particular is a big one, right? We don't have a lot of healthcare, mental health, or physical healthcare assistance for veterans who often find themselves in poverty and unable to work. Right, so the decision to work is often driven by policy, or the decision not to work in this case is often driven by policy rather than individual preference. Likewise, someone who could be working but isn't might be facing one of these poverty trap situations where if they chose to work more, their government assistance would be cut, meaning they wouldn't be any better off, and so they choose not to work. So because the poverty trap is an inherent problem in government assistance and government assistance methods, we have a few other types of government assistance, which are detailed in chapter 15. I sort of want you to just be, kind of loosely aware of what these assistance programs are, and then to a certain extent on the next slide, why they're controversial or what the debates might be about them. Why there would be arguments in favor, why there would be arguments opposed to these types of safety net programs. All right, so a few different examples of safety net types of programs which the government provides. We have the TANF, which is Temporary Assistance for Needy Families. This is only available to those who are already working, and so it tries to avoid the poverty trap by only being available if you do work. And then we have earned income tax credits, and as it states, again, the earned income. So this means kind of suggests that you are working, and then your tax burden is going to be relieved a bit for those who work. And then also as part of EITC, these benefits are only reduced once the earnings meet a certain level. So if you're still in poverty, you make a little bit more money, but you're still not very well off, you won't have your government assistance cut, which can help to avoid that poverty trap. All right, there's a couple other well-known types of assistance programs which might fall into the poverty trap, which are food stamps, SNAP program, and Medicaid. And in these two cases, those assistance programs will be cut as you earn more income, pretty much linearly, directly related to your income. And so these could fall victim into the poverty trap. Nonetheless, food and healthcare are pretty important features of day-to-day life. And so, again, we see a potential role of government intervention. Even if we have these problems related to government intervention, and we haven't even really talked about the critiques of government intervention much yet, even if you have these safety nets and trying to avoid poverty trap, it's possible to still fall into it, potentially still better than nothing. All right, so finally, some critiques of government intervention. Those especially who lean politically conservative often oppose these types of assistance programs. So why economically might that be the case? Well, first of all, it's costly. Subsidy of positive externalities is costly, as is the provision of public goods and services, as well as these assistance programs. And so the government needs to be very careful that it directs its spending in a productive manner. From the individual level, taxpayers who consider only private and not social demand might not value the government goods or services being provided, or more generally, people who don't use the goods and services being provided might not value them, and therefore they might not want to pay tax money for them. Subsidization, in addition to being costly, might not be guaranteed to produce the socially optimal quantity result. So, this is sort of referring more back to this graph. How can the government guarantee that they subsidize the right amount to make the private demand quantity into the socially optimal quantity? Well, there's really no way to guarantee it. So, some sort of inefficiency concerns in addition to cost. There's disagreements over which public goods to produce and how much to spend. So even those who want public goods provision might not agree on which types of public goods or how much to spend on them. And then there's concern that the government assistance programs can discourage individuals from working more hours. This poverty trap we've talked about, if their assistance will be cut when the work hours increase. Often, again, I think this is misdirected into a stereotype about the lazy, not working poor. But again, this can be a utility maximizing decision as well as a product of many other factors. Right, so as a summary, in economic theory, it's the role of a functioning government to intervene in cases of what we call market failure. And then we studied throughout the last 2 units a number of different examples of what we call market failures in economics. So what were the market failures? Well, we had unemployment, which occurs if GDP is too low, referring back to the last unit, aggregate demand, aggregate supply. If the intersection falls below some sort of long run level, then not enough people will be employed. We could have the opposite problem, too much production leading to inflation. So our intersection of aggregate demand and aggregate supply is at a place where prices are too high. We have externalities. We focus mostly on positive externalities and the role of government in encouraging more education, more vaccines, and so on. But there also might be a role in government of correcting negative externalities like pollution. We talked a little bit about government assistance programs to correct poverty, homelessness, and famine. And then I kind of took it out of the required reading, but it's interesting to consider the modern debate of government intervention into crime and policing policy. And it actually seems like different states are going kind of different directions on policing policy. So again, you can see that economists and politicians, scholars do not agree on the extent of government intervention, where should governments intervene and how. So even if economists recognize that these types of market failures do exist, there's still discussion and debate on what the government should do to correct these problems. All right, in a couple days, I will put out a content video for the second reading quiz along with a topic list. Feel free to reach out if you have any questions.